Hi, my name is Kate, I'm a physical therapist, and today let's talk about sciatica caused by a disc herniation. On my channel you'll find at least few different videos with different exercises for different types of sciatica. Why? Because sciatica treatment is always based on its causes. We will use different exercises in sciatica caused by disc herniation and different exercises in sciatica caused by, for example, foraminal stenosis or spondylolisthesis. Most often, those exercises will be in opposition to each other. So what can bring a relief in sciatica from discopathy can worsen the condition in, for example, foraminal stenosis or spondylolisthesis, and vice versa. That is why we should always remember that in sciatica treatment there is no one-fits-all therapy, and we should always know exactly what is pinching the sciatic nerve to choose the exercises properly. So today we will discuss sciatica caused by a disc herniation, by a discopathy, the most common cause of sciatica. We will quickly go through anatomy and pathophysiology, and then I will show you exercises that I'm using in my practice in acute, subacute and chronic stages of this type of sciatica. So stay with me. Regardless the cause of your sciatica, we have two golden rules in therapy: no painkillers and symptoms centralization. First, medication. In acute phase of sciatica, when the pain is very strong, patients are prescribed painkillers so that they can function at all. And of course, when the pain is very strong in first or second day after the symptoms occurred, it's absolutely normal to take these drugs. However, when we start the therapy, it's necessary that my patient is not under the influence of any painkillers, because it will disturb the assessment of the effectiveness of my therapy. That is why I always ask my patients to come to my office only if they have not taken any drugs. Second rule is a symptoms centralization, and this is the most important rule in sciatica treatment. Symptoms centralization is a withdrawal of the symptoms towards the center, towards the spine. For example, you have sciatica and you feel the pain in your back, buttock and thigh. And after the exercise or during the exercises, you feel that it is limited only to your back. This is great. That means that by properly chosen exercises, we have managed to decompress the nerve and that the therapy is well chosen. This is a symptoms centralization. However, when you have a pain in your back, buttock and thigh, and after exercises you start feeling the symptoms in your calf or even in your foot, this is bad. You should stop those exercises immediately. That means that by wrongly selected exercises, you squeeze, you compress the nerve even more, and that means that this therapy is not properly chosen. And this is what we call a peripheralization of the symptoms, something we don't want to see in our therapy. So remember about those two rules: no painkillers and symptoms centralization. Okay, so now let's quickly go through anatomy and pathophysiology. Disc herniation or discopathy is the most common cause of sciatica. Disc herniations that can cause sciatic pain are lesions at level L4, L5 and L5S1. So we got two intervertebral discs that can be damaged and can cause pain. Usually those are posterolateral injuries, which means that the disc is bulging towards the back and towards the side. This is where the nerves that make up the sciatic nerve come out of our spine. The damaged disc over here bulges, presses against this nerve, resulting in sciatica symptoms such as sharp radiating pain, numbness, or disturbed muscle strength. Let us add that this disc can be damaged in various ways, from light bulging to sequestration. But most often we are dealing with something which is called a protrusion of the disc, and this is a situation in which the outer layers of the intervertebral disc are not damaged. The good news is that this type of damage can heal. It takes several weeks, although some scientists say that it takes even up to 1 year for the collagen fibers to fully regenerate. Anyway, it is generally assumed that the improvement occurs within 6 to 12 weeks with this type of damage. In acute stage of sciatica caused by a disc herniation, we have to be very careful and act very slowly. Patient will present a very specific posture, a very specific pose. Let's assume that I'm having a right sciatica. My trunk will be slightly bent. I will have my right hip and my right knee flexed, and I will walk with small steps, I may also limp. Why small steps? Because if I made a long stride, it would lengthen the nerve and cause more pain. What is also very common is a trunk shift towards the opposite direction. So I have the sciatica in my right leg and my trunk will be shifted towards the left, towards the opposite side. This is a natural pain-reducing pose made by a patient, because look, if I'm having a discopathy over here and the disc is pressing against this nerve, if I bend my torso a little bit and move the trunk towards the opposite direction, I am giving here this disc more space. So the disc has more space and the nerve has more space. So this is a natural pain-reducing pose made by a patient. Also, patients can hold the area of the lower back with their hands. So this is how the patient is going to enter the office in acute phase of sciatica caused by a disc herniation. The most effective therapy in treating sciatica caused by a posterolateral discopathies is a hyperextension therapy. It involves performing specific poses that will bring the disc back to its correct position. But to do it correctly, we need to do it in a specific order and in a specific timing. So first, what we will do is to decompress the area of the disc. We will give the disc more space, and then by hyperextensions we will provoke to direct this disc towards the abdomen. How do we do it? We start with lying on a stomach with the pillows under the belly. We stay in this position for about 5 minutes. What is happening right now? There is a traction in the lumbar spine, so the vertebral bodies move apart, giving more space for the intervertebral disc. If after 5 minutes it's fine, we remove the pillows from under the belly. If it is okay, the patient stays in this position for another 5 to 10 minutes. What is happening now? First, we gave the disc more space. Now, through the lumbar lordosis, we gently direct the disc in the anterior direction. If the symptoms do not worsen, I ask the patient to move to the forearm support. Remember that the symptoms cannot get worse. What's going on? We increase the extension in the lumbar region and direct the disc more strongly towards the abdomen. If my patient tells me that it is okay, I ask to perform 10 slow rises on the forearms. If successful, the patient performs 3 sets of 10 repetitions. In acute condition of sciatica, this is where the hyperextension therapy ends. It's ideal when the patient notices a centralization of symptoms. It means that we are going in the right direction with the therapy. As you can see, in this acute therapy, the time is very important. We are in no rush. First, we have to decompress the disc to give it more space and then to gently direct it towards the abdomen. If we were to immediately put the patient on his stomach and order him to perform the hyperextensions, we would cause the opposite effect and intensify the symptoms right away. In the acute phase of sciatica, when my patient gets off the exam table and it is a little bit better, I show some more exercises to do at home. Those exercises are aimed at the maximum nourishment of the intervertebral discs. Because intervertebral disc does not have its own blood vessels. It is not supplied with blood, and the nourishment of the disc occurs during the processes of osmosis and diffusion, and it takes place only when the disc is compressed and decompressed, compressed and decompressed. That is why it's extremely important that we should do those exercises for the disc to heal quicker. Here are these exercises. The patient stands in front of the door and grasps the top of the wing with both hands. If the door is too high, we can put some stable pads under the feet. The patient stands apart, gently bends his knees and very gently stretches his spine. The point is not to hang on the door, but only to gently relieve the spine. Then we extend the legs. When the legs are bent, the discs are gently decompressed. Of course, this exercise should not aggravate the symptoms. We should do it for about 3 minutes every 1 hour. Next exercise. We start on all fours, spread our knees wide, our head should be in the extension of the spine and our lumbar section should be in an intermediate position, not maximally flexed and not fully extended, but in the middle. In this position, we descend with the pelvis towards the heels. Then we return to starting position. The idea of the exercise is the same. When we approach the heels, the compression takes place. When we come back, we compress the disc. We perform this exercise very slowly for 3 minutes every 1 hour. In acute stage of sciatica, patients often ask questions for how long they should stay in bed and rest. And the answer is surprising because they should be as short as possible. Today, we know that a variable load is needed for the disc to heal, which is a compression and decompression, compression and decompression. So if you stay in the bed for too long, it will just take longer for your sciatica to heal. And of course, we can afford 1 or 2 days of rest, but no more. If the patient can stand up and walk, he should do so. So the last exercise that I recommend to my patients during the acute stage of sciatica caused by disc herniation is walking. The patient should walk for about 5 to 10 minutes, slow pace, on the straight ground, with small steps, but equal for right and left leg. And then after the walk, he should rest in the position which will relieve the pressure on the disc as much as possible. And I will show you this position right now. This is also a great position to relax and sleep during the acute stage of sciatica. Lie down on the side opposite to the painful side. We assume that I have sciatica in the right leg, so I will be on my left side. Place a large pillow under the waist to move the vertebral bodies away from each other and give more space to the disc. Place the right leg bent at the hip and knee, placing a large pillow or two under the knee. Remember that the hip flexion should not exceed 70 degrees, as this provokes a lumbar flexion that we do not want at this point. Let's summarize what we do in acute phase of sciatica. Extension poses and these 3 simple exercises to support the regeneration and nourishment of the disc. Around 1-2 weeks after the first symptoms occurred, we enter the subacute stage of sciatica, and then we can intensify the exercises. Regarding hyperextension therapy, we change timing and add some more pauses. We start with lying on the stomach with a pillow for 2 minutes. Without a pillow, 2 minutes. Supports on the forearms, 3 sets of 10 repetitions. And we add supports on straightened arms, 3 sets of 10 repetitions. As always, we remember the principle of symptom centralization. I add more complicated exercise for compression and decompression of the disc. While lying on the non-affected side, I put my knees slightly beyond the edge of the exam table. Then I lower both bent legs beyond the table and then come back lifting them up. When the legs are lowered, decompression takes place. When the legs are lifted up, compression takes place, and again, we favor the regeneration and nourishment of the disc. We do this exercise for 2 minutes, approximately every 2 hours. In the subacute phase of sciatica caused by disc herniation, we can start mobilizing the sciatic nerve and perform the so-called neuromobilization. Neuromobilization is a technique to improve the mobility of the sciatic nerve, and it's sliding in relation to other tissues. How to do a sciatic nerve mobilization? While lying on the pain-free side, in my case on the left, I put pillows under my right leg, bend the hip about 70 degrees and bend the knee. I start mobilization with the dorsal flexions of the foot. I perform it very calmly, listening to my body's reaction. As you remember, I will repeat it ad nauseam. Exercise should not increase the pain or should not cause the peripheralization of the symptoms. If it is okay, we perform 30 repetitions of dorsal flexion of the foot. Then, in the intermediate position, I'm trying to straighten the knee. Here, usually in the subacute phase of sciatica, I will not be able to perform the full extension range. That is why I do it only as much as I can in a painless range. We do 30 repetitions. We perform neuromobilizations 5 times a day. Of course, we also increase the walking time up to 15 minutes. During the walking, we try to lengthen the steps to our normal steps, the same as we were walking before the first symptoms of sciatica occurred. To sum up, in the subacute phase, we perform extension poses, we add straight arms, compression and decompression exercise, and 2 sciatic nerve mobilizations. And of course, walking. At 3-4 weeks, we enter the last stage of sciatica treatment, in which we can perform much more interesting exercises. But always remember about the rule of symptom centralization. At this stage of sciatica, the pain should be much lower and the symptoms should be significantly centralized. We continue the hyperextension therapy, starting with 1 minute of lying on the stomach with a pillow, then 1 minute without a pillow, then support on forearms, support on straight hands, and we can add support on straight hands with pressure. This can be done by a physical therapist with their own hands, or you can use a long towel. Place it at the level of the lumbar section and hold the ends in your hands, tightening it. And start do the extensions, 3 sets of 10 repetitions. We can already give up exercises to compress and decompress the disc because at this stage of sciatica, patients are usually active enough so that this compression and decompression takes place many times during the day anyway. We can now start neuromobilizations in the supine position. In my case, I keep my left leg straight and bend the right leg by 90 degrees and support it with my both hands. Then I perform knee extensions with the foot dorsiflexion at the same time. Of course, as painless as possible. Here's a small note. If you feel a pulling in the area of the back of the thigh, we do not care about it, because these are usually shortened hamstring muscles, not the sciatic nerve itself. We perform 30 repetitions 5 times a day. At this stage of sciatica treatment, we can introduce many different exercises, as I say, from the internet. However, always remember about these rules that I mentioned in the beginning of the movie. No painkillers and symptoms centralization. So don't use any painkillers before you start exercising. And if any exercise provokes a sharp radiating pain, shooting pain to your leg, stop it immediately. Okay, so here are the examples of exercises that we can perform. On all fours, we stretch out the right hand and the left leg, then opposite. Cat and cow. Lifting the hips while lying on the back. Drawing both legs to the chest and touching the forehead with the knees. For more athletic people, we can start some planks. During this period, however, I do not recommend rotational exercises such as moving both legs to the right and left sides while lying on the back, rotating the torso in standing position, or such stretching taken from yoga. Remember that the disc continues to heal and the damage mechanism is rotational one. Besides, our lumbar spine is not designed for high rotation. This range is relatively small, and until the disc is completely healed, we should not enter the maximum rotation ranges. And here at the end, a small note. Do not self-adjust your lumbar spine when you have sciatica. Why? Because self-manipulation techniques shown on the internet are forcing the maximum rotation within the lumbar spine. And as we already know, this rotation can be very dangerous because the disc is not fully recovered. The disc is still healing. So instead of helping yourself, you can do the opposite. To sum up, in the last stage of sciatica caused by discopathy, this is what we do. Hyperextensions. 1 minute of lying on the stomach with a pillow, 1 minute without a pillow, supports on the forearms, supports on straight hands, supports on straight hands with pressure. We introduce neuromobilization in lying on the back. We perform more and more various exercises in sagittal plane, we also avoid rotation. Of course, we walk all the time, 30 minutes of walking with lengthening steps. We work this way until around 6th week, and usually during this time, most of the patients experience complete withdrawal of their sciatica symptoms caused by a disc herniation. And that will be all. I hope that you find this video useful, that exercises that I've shown you helped you to relieve your sciatica pain. And if you like the movie, you can always appreciate my work by giving me a thumb up, leaving a comment, sharing this video with others, and of course by subscribing to the channel for more videos on physiotherapy. Thanks for watching, and bye.